Hi there. I would like to share my journey from as Indian nurse to the KSA nurse. First of all, I have attended an interview in the Delhi where around 300 nurses have taken participation from all over the India. So usually the Ministry of Health will conduct the interviews in the Delhi itself. So you cannot able to approach by yourself. The ministries have their agencies in the India. So in India, the main agents will have the secondary and tertiary agents, where when you go in the secondary and tertiary, they will cost a lot of fees to you than the main agency. So this is I was really in loss with the fees of the agency because I have got the secondary agent. Actually, your friends or any person known to you, they will not give you proper information that which agent you need to go through. Even though a lot of friends work in the Saudi Arabia, I have asked to them frequently regarding how much fees you have paid, but none of them have said to me. So I was in loss with the fees. Usually, some of the people with me, the nurses, they have paid to their agent only 80 to 90,000. Most of the people, they have paid 1 lakh to the agents. But whereas me and some of the people have paid around 3 lakhs plus to the agent, just the fees. I'm not talking about the data flow, prometric, etc. Okay, so I was really in loss of it. Then then I have done. Okay, then from Hyderabad I have traveled to Delhi on just a day before the interview. There I have attended the interview in a very lavish hotel. Then there first there will be three parts. Okay, in the first part you are going to attend with the quiz session, means question and answers you need to give it. Then they will immediately on spot, they will do corrections, and based on the percentages they will select, and if you are fail on it, they will let you go from the first step itself. Okay, from the first step. Then as I was going to deal with the critical care, means I have appeared as the critical care nurse. So my second round, there was face-to-face interview where there will be as critical care, the doctors have attended they have conducted my interview. A lot of questions he have asked. The cardiologist was there. He have asked really around 10 to 15 questions. Then at last he have written excellent on my uh, evaluation paper. So I was really very happy and glad of it. Then the third round will be your HR round. In the second round, also, if face to face interview you are not able to give proper answers to the interviewer, especially in the English, then they will cancel your interview. They will fail you and they will send you from the second round. Then the third round was my HR round, where in the HR round they will be setting up your salary. And if you are agreeing with your salary package, then they will fix on that and they will take your signature and they will let you go, and the agent will be carrying out your rest of the process. You will not come to know anything, means you will not get any extra papers for that. Just they will give you appointment letter, offer letter. You need to sign it and give. They will update in the system, and that papers will go directly to your agent through whom you have come over there. They will not give on your hand anything. Okay, so in that also means based on your degree, based on your years of experience, your salary will be getting set on. Then the next thing is, after facing the interview, then I have returned off to my home a very next day of it. Then the whole day the interview, I was busy with my interview, and you need to take some eatables along with you, because you will not get time to go out and eat something. Then whole day you will be busy in these 3 rounds. After that, when I came after 3 to 4 days of it, I have received my appointment letter in the mail, and then I came to know the fees of the agent. That was a high loss for me. Before of it, if I would have come to know, then it was much more benefited that I would have changed my agent. But later, now I cannot do anything. The offer letter is with the agent. So, however, I have to agree with the fees of my agency. Then, after a few days over, he have asked me to do the data flow and the prometric exam. The both was filed up. Then the passport was sent for visa approval. Then after getting the visa, and if you are having double the passport of your identity, then you need to send all two together, or it will be taking much more time, like second week you will be taking more to send your second passport if they are asking to you. So it's better how many passports you are having, it's better to send off that many passports to them. And if you are selected under the Ministry of Health and all, they will be giving you complete allowances, food allowance, housing allowance, and also if you are a critical care nurse, critical care allowances. Then plus of it, you will get the ticket also after your visa approval. So that's it. Then I came off at the airport. The vehicle was also arrived on time to pick up us, and the housing was provided by the Ministry of Health itself, by my hospital. So that was a great journey, and I'm so happy of it. Thank you.